Welcome to the Health by Haven podcast. I'm your host, Haven Quinlan. If you're a multi-passionate wellness enthusiast, then you're in the right place. I'm obsessed with learning as much as I can about the wellness world, and I want to share that with you. Each episode will dive into various aspects of health and wellness through inspiring and informative guest interviews with some solo episodes thrown in. Tune in for all things health, and let's have some fun, shall we? If you've been listening to the podcast or following along on Instagram, you probably already know that I'm getting ready for a big move back up to New York City. I'm so excited to have a new space to design, and while I don't know exactly where I'll be living yet, one thing is for sure, my home will feature artwork from my favorite Etsy shop, Arranger Paints. My favorite piece from the artist Steve is a painting of the New York City skyline. It's hanging over my desk as we speak, and it will certainly be making the move to the Big Apple with me. If you're looking for one-of-a-kind artwork to personalize your space, be sure to check out arrangerpaints.etsy.com. As a special thank you for Health by Haven podcast listeners, use code HXH10 to get 10% off your next purchase. Thank you for your support of the show and for supporting our podcast sponsors. Now, back to the show. Today is a very exciting episode of the Health by Haven podcast because I sit down with my chiropractor, Dr. Franya Peterson. I originally went to see Dr. Peterson on my friend Sarah's recommendation and because she uses a holistic wellness approach, which you'll hear all about in the episode. Dr. Peterson has found satisfaction in helping people improve their quality of life through chiropractic care, and she thrives on forming close relationships with her patients in order to help each person achieve their healthcare goals. In the episode, Dr. Peterson covers the myriad of reasons why you may benefit from chiropractic care, including pain relief, stress management, and preventative healthcare. She discusses the techniques and tools that she uses to adjust patients and covers why it's so important to find a practitioner that you trust and who will help you find solutions to any problems that you may be facing. If you've been considering seeing a chiropractor, but you're a bit nervous like I was, or if you simply want to learn more about chiropractic care, nervous system function, and how it's all intertwined in the world of health and wellness, then this episode is for you. Dr. Peterson, thank you so much for joining us today on the Health by Haven podcast. I have so enjoyed seeing you as my chiropractor and felt like we were very aligned in all things kind of holistic health from the beginning. And so I just knew I had to have you on the podcast. So thank you so much for joining us today.
Well, thank you so much for asking me. I'm very excited to be here and to have this conversation with you. I'm really excited.
So for people listening who don't know you or haven't been to your practice at all, can you give us a little bit of a background, fill us in on how you came upon the world of chiropractic care and why you decided this was what you wanted to do with your life?
Yes. Well, so I am a chiropractic kid. My dad was a chiropractor. And he got into chiropractic because he had a scoliosis and he had had a back injury that chiropractic was really able to help him with. And so he decided that's what he was going to do. And he had two children, my brother and myself. My brother's a little bit older. He decided to go into chiropractic. And at that time, when I was graduating high school, I was going to actually be a vet. And so went through school, did all of my basic sciences and all of the work towards undergrad, and then decided kind of at the last minute that I was not sure that I really wanted to go the path of veterinary medicine. So I decided that I had been working in my dad's practice for years before that, and I had learned the whole field. I had been certified to take his x-rays and do his therapies and file his insurance and done all of that. So I really knew the type of field and the practice, and I enjoyed working with people. So I decided to go ahead and go to chiropractic school instead, and I have been enjoying it ever since. And I actually got certified in animal chiropractic, so I get to do the animals too.
Oh, full circle from the vet
full
school.
Circle. So it's been good. So I've been in practice now since 2003. and doing animals since 2005. And yeah, just really, really enjoyed the practice and enjoy helping people live a little bit more holistic lifestyle, help them to be able to move better and feel better and hopefully make better choices for their health care.
Amazing. And I mean, who knew that your animals, your pets could get chiropractic work as well?
Yep, I know that was something I discovered along the way, and it's a small but necessary field. It's exciting and it's helpful.
Do you mostly do cats and dogs then?
Yeah, yeah, I just do small area. Yeah,
Okay, makes sense. Maybe there's some horse chiropractors out there
there
somewhere.
are. I
Oh
know
my
several.
gosh.
Yes.
Oh my gosh. Okay, so growing up with your dad being a chiropractor, I imagine, did you have chiropractic adjustments as a kid then?
I did. Yes, I sure did. All the way growing up, anytime I would, um, well, he would adjust me on a regular basis anyway, but then especially I was an active kid. I was kind of a tomboy and into gymnastics and just dance and all kinds of stuff. Enjoyed just being active and busy. And so when I would kind of injure myself or hurt myself, he would always fix me back up and get me back out playing again. And so, yeah, I've been adjusted since I was a little kid.
That's so cool. And it was honestly only kind of recently that I learned like children ever even went to a chiropractor. It's just not something that I grew up with, And so it was like very surprising to me.
Yeah. Yeah. Well, they have little spines and they chiropractic is not only for injury based, but if we just about it from that perspective, if you think about it, children probably fall more often than most people in like their middle ages, only when we become much older and hopefully prevent falling. But that's probably the next stage in life that people fall as often. So really their spines go through a lot of growth and development, and it's very important to keep those joints functioning and moving well. And then when we talk about it from the perspective of development, we want to make sure that that nervous system has the most clear communication for it to perform all of its body systems and functions as optimally as possible. And so that's also where chiropractic does a beautiful job, is just keeping really good, clear communication so the body does perform at its best level and does exactly what it is supposed to do, the way God created us and how we're supposed to be able to move and perform.
So I think I don't know if it's a common misconception or just, from my understanding of very limited knowledge before I ever had any adjustments, like chiropractic seems very physical, like on the outside, this thing hurts and this is why I'm getting adjusted. But I know now that it's also connected to the nervous system, like you had just mentioned with children. So can you bridge that gap for people who are like me, who are like, what do you mean? Like it connects to
Yeah.
your nervous system as well.
Yeah, for sure. So um, basically, as you know, we have the central nervous system is made up of the brain and the spinal cord, and that is our master controller of our body. We have hormones and everything else that also play a very, very vital role, and we know more about our gut-brain barrier and things like that that are really important as well. So it all works together, but coming back to that central nervous system, it comes down through the spine encases it and holds it and protects it and allows us to move. Um, but the beauty of it, and also in our kind of like ability to injure ourselves or have problems with it, is we have the ability for it to not um, have as clear communication when it comes through those, because as it comes down through the vertebral bodies or the spine itself, those are all individual segments. And then there's spaces in between them that allow those spinal nerve roots to exit out. And then that allows the nerves to flow to all parts of the body. And in those segmental levels, if we don't have good, proper movement, then we can develop inflammation in that area. We can develop just poor joint movement, and that will sometimes allow there to be this interference that does not allow the communication to flow as well. And then we're learning a little bit more about other types of things too. We understand that there's like some touch sensations and things when we're touching the body, and there's an awareness that happens with that I think science is trying to catch up with what chiropractic has done for a long time, and we're not quite there yet as far as fully understanding and knowing it. But basically, we need our nervous system to be communicating as well as it possibly can. And chiropractic is one way for us to be able to do that. It's not the only way. There are other ways that we can affect that, but I think it's a good, important way, and it's highly effective.
Okay, so are you seeing a lot of patients come in because they're having maybe some nervous system dysfunction, like maybe like you were talking about the swollen joints, or I don't know, I'm picturing like if you're having weird numbing or tingling or things
Yeah.
like that.
Yeah, I'd say that's probably, at least in my practice, I would say that's probably the most common reasons that people come. They've either injured their backs or their neck, or they're having strange tingling and numbness or into like maybe an arm or a leg or a part of their body, or perhaps they've got some weakness in an arm or a leg that is sudden and new. And so they're looking for a way to try to help correct that or improve it without necessarily jumping into like spinal injections or surgery potentially. That's very scary to a lot of people, as you know, it should be. That should be a more final option rather than a first option. So hopefully finding ways for us to be able to affect this and help people with this without having to jump to those more invasive things. Keep those things for if that doesn't correct with a much less invasive treatment plan.
Yeah, and I love that approach of like, let's figure out like maybe there's some other things we can do before we jump into the big
Yeah,
scary stuff.
yeah, me too.
Okay, so those are some of the things, and maybe the most common things that people are coming to you, at least in particular, for. I think when I was growing up, I used to think like, well, for example, my dad went to a chiropractor as I was a kid when he had back pain, and that was like just what I thought it was for. Oh, they
Yeah.
just pop your back, and that's about it. What are some of the other things that people may benefit going to a chiropractor to get help for?
Okay. So general um, health and wellness, we talk to people all the time about foundational health principles. We want to make sure that we have good sleeping habits so that we get as much rest as possible. That's when our body's doing a lot of the healing. We want to talk about nutrition and being able to eat good whole foods that are healthy, that are going to help to hopefully reduce inflammation throughout our systems in our body. Um, Exercise is one that I'm preaching constantly in my practice that I really try so hard. I tell people the best way to stay out of my office is to exercise, because you're not going to need as much chiropractic care as someone that does not move as much, and then their spine is not as healthy, their muscular system is not supporting that skeletal system, and they're going to have more aches and pains or more poor function of joints and things like that. So we talk about those types of foundational things. So for me in my life, I find that I feel better when I get adjusted on a regular basis. Now, I have typically in my whole life had someone in my family that was able to adjust me.
Hmm.
So that was a really easy thing for me to do.
Hmm.
But here recently, my brother has unfortunately had a health crisis and has not been able to be in the practice. And so I'm still getting adjusted. I have a friend of mine who's another chiropractor, and we adjust one another. So I still feel like I just feel better, move better. I sleep better. All of those things are so helped by getting adjusted. And so that's one area. So just in general, wellness and feeling better and moving better. Something else that I've noticed, pediatric chiropractic for children.
Hmm.
Um, Parents can sometimes have trouble with their kids. They get this label of like they have a colicky child, or they're fussy. They cry a lot, and in that newborn stage, we're trying really hard to figure out what our child needs, and it's a very overwhelming time period. And if we can make our babies more comfortable and we can help them to sleep better, nurse better, um, all of those things that babies need to do, then that not only helps the baby, but it helps the parents to feel a little calmer and to enjoy that phase in their child's life. So I think that's another one too. There's a lot. There are many more. I probably could go into more, but that's just to name a few.
Yeah, definitely. And like those are some that I wouldn't think of maybe off the top of my head because I don't know. I think a lot of us have ingrained in us like, oh, you only go to the doctor when you have something wrong. And I kind of love the preventative care approach so that you don't get to that point.
Yeah. I think that's really, for me, that's, yes, I do a lot of treatments for problems, but if I can try to help people to realize, like, let's do things to keep our bodies functioning and performing better so that we age in a much better way and a much more vibrant way. That isn't that what we all really want? I mean,
Mm.
we would all love to age gracefully and well so that we feel better and move better and live longer, you know? And so I think chiropractic for me is a very, very integral, important part, but it's just a piece of all of the things that I feel like people need to do and need to know about of how they can do that, you know?
Yeah, and people who are listening who are longtime listeners are like nodding their heads. They're like, oh, this is why they're so aligned. Because I'm like, yes, when you're talking about the nutrition, yes, when you're talking about the exercise, like all of it goes hand in hand. You can't be like super great in one area and forget about all of the rest.
You can't, you really can't.
I saw you several times to get adjusted, and I had never been to chiropractor before, and I was very nervous. And your sweet office, everyone was so nice to me and talking me down off a ledge when I was like, I'm really scared and I don't want you to pop me or crack me. Like, but I'm having all this shoulder pain and it's kind of coming into my neck and blah, blah, blah. So I got to the point and my friend Sarah recommended me to you and she loves you as well. But you guys talked me off the ledge and I came in and it's not scary at all. But anyways, for anyone who, as I'm rambling, for anyone who maybe you're currently in the same boat that I was, like, oh, I've never
Yeah.
been there, but like I'm afraid they're gonna pop my neck and I'm gonna be paralyzed forever. You know, that's my worst case scenario brain. Talk to us a little bit about like what it's like to go see a chiropractor for the first time.
Yeah, absolutely. So one of the main things to understand that I think is not well known is that we have so many different ways to perform our chiropractic adjustments. And that means that you can find, I always say it's the beauty and the curse of it because if you try a chiropractor and you don't necessarily enjoy the experience, or you felt, nervous about it, or you just really didn't have a great experience, you can find another practitioner that does it in a very different way. And so we can all find ways that feel good to our body, that our bodies can respond really well to, and we can get the results that we want. Most people think of chiropractic as far as the what I call the more manual style. There's particular names for those, but there's
Mhm.
techniques that we're taught in school, and those are the most common ones. And that's in fact what I was taught. That's what my dad performed when I was a kid, and he was fabulous at it. I enjoyed that type of adjustment. I chose not to do that style. I use a little different adjusting style. In school, we were taught many different techniques, and I chose a little bit gentler approach, a little bit uh, I guess what a lot of like you would say a little less scary approach.
Mhm.
The techniques that I like to use, I use some adjusting instruments, and so the person just continues to lay or sit in a very quiet manner, and there's not twisting and turning that's happening. So that reduces a lot of the fear, I think, for some people. And then I also use a table that is called a drop table. It's Thompson drop table. And that also you just lay in a very still manner. And I'm not going to do any twisting and turning, just the table. The table raises up and then I push and it's going to drop. And there's different physics how each technique works that can be explained to you. But basically, there are ways that you can make it as light or as forceful. So I've had some patients that come to me that have been chiropractic patients for long times, and they really want the more forceful manual style. And they don't necessarily enjoy the way that I adjust them. It's not necessarily that they don't get the results that they want, they just prefer the other technique. So the reason I say it's the beauty and the curse is because if you really like a certain way that a chiropractor adjusts, you're never going to find two people that are going to adjust the exact same way because it's our art form and it's the way that we apply it. However, if you don't really like the way somebody adjusts you, doesn't mean chiropractic is not for you. You just need to go find somebody else in a different style. So I think in TV and YouTube, the ones that get the most views are probably the ones that are the much more manual style because they're a little bit more sensational looking, and you
Hmm.
can hear the audible and you hear the pop or the crack that people experience. And that's just the joint capsule. There's gas within the joints themselves. And when you release it quick enough, there's going to be a noise that's made. But just because that doesn't make that noise does not mean that the joint has not released. And so my technique doesn't usually release it in that fashion. You won't hear as much, but you will feel, as you know, you feel the difference in your body, and the joint mechanics improves, function of the body improves. And that's really the end result we're all trying to get to, is better function, better motion of the joint. And then, of course, if we're having any kind of nervous system interference, then we're going to have improvement on that too.
Yeah. And for anyone listening, I did use the table and it's not scary.
It's noisy, but it's not
Yeah, the
scary.
table is loud, but then it's not like your back is popping loudly.
No,
So,
yeah, exactly. Yeah,
okay,
yeah.
what about the other little tool that's like a little clicker?
Yep,
I
it's
don't
called
know
the
what it's called.
activator. That one is
Act.
called the activator. Yep, and that's been around a long time too. So people think these are newer techniques. They're really not. Like the drop table was invented back in the 1930s. The activator, I don't remember when that was invented, maybe in the 70s. I can't remember. But it's been around for a really long time. And yeah, it's a spring-loaded, it looks like an old-timey shot, but it doesn't have any kind of needle on it. It has a little rubber tip on the end. And so I can adjust the tension based on what part of the body, if I want more tension or less. And what that does is it creates a really fast impulse that allows the joint to be moved in a quick fashion. So basically, all chiropractic adjustments, we want to have some speed and we want to have some force against the vertebral body, which is the part of the mass that we're trying to hit. And so, depending on how we do that, if we can do that quick enough, we're going to have a change, and we're going to have it's going to make a difference. And for the other chiropractors out there, they're probably going to blast me on how I'm explaining this, but I'm trying to keep it simple for people so
Yeah,
that they
that's
can kind of
great.
visualize and understand it a little bit. So we could get a lot more technical, but I'm not going to do that. But basically, we're trying to affect the joint, and we're trying to also affect the soft tissue in the area, so that we can have a quick stretch on the muscles, and that's going to reset those little the organs that are within them. So hopefully they will relax, and we're going to try to get the joint moving.
So when you used the clicker on me, I was having some like neck issues and you used it kind of like on the side of my neck, which sounds scary, but I promise it wasn't scary for anyone listening. But like I would come home and tell my husband, I'm like, she has like magic powers because you would like kind of press my neck with your hands and like right in the spot where I'd be like, oh, that doesn't feel good. You'd like stop and use a little clicker. And like, how do you find the spots like that people are having issues with like just right away? And you're like, yep, this is where I need to use this.
Yeah, I think that is probably the best way that we can prove to patients that really there is a reason for your discomfort or pain when you were coming for pain, and there's a reason for it because the texture of everything changes. There is a chemical process that happens. You've got some inflammation over that area. There's some edema, and so when we find those areas, it feels different. It feels different to you, and it feels different to me. And so in school, chiropractic school, they start teaching us. We start our it's so the school that I went to, we were on quarter system, and it's a 4-year program, and it's a doctorate program, and they start us very first quarter with palpation classes, and we have them all the way through because you've got to develop your tactile sense, and then you still get out of school and kind of feel like you can't feel anything, but through years of experience, you really do develop a higher sense with your palpation skills. And so you can find those areas because they feel different. And when they are corrected and they're adjusted, they feel different again. They feel more normal. They feel like everything else. So that's not where somebody's finger wants to land. And it's like, oh, that's where it's really, really sore. Or that's really tender, or that sticks out right there, or that is really hard, or it's kind of mushy there. All of those are kind of the ways that I would say people experience it. And that's because it really is happening that way within their body. It is the texture changes.
Okay, then after you had adjusted me for several of these things, I just started listing a laundry list for you. I'm like, well, this thing actually is bothering me too, and what about this? So I'll just name off a few. I don't mind sharing my medical history on here. You're not disclosing anything, but for someone, for example, I know a lot of people struggle with IBS, whether it's one end of the spectrum or another, or a mixture, and so is that something they can go to a chiropractor for to get help with?
Yeah, I mean, I think definitely, I think it's one of the things that you can put into place with your journey of trying to figure that out for sure. Because we come back to what's your master controller, right? Central nervous system. We want to make sure that we've got good, proper nerve flow. Um, so I would definitely tell patients that it's not the only, once again, other chiropractors might get on to me about this, but it's not the only thing because there are a lot of different reasons why IBS can affect a person. And I think that to not explore those other things would not be fair to the patient. So we have to talk about um, potential food irritants. We talk about I've even recently read, well, I think it was your podcast that it was the one about trauma and how we store that in our body. Like there's just so many things that we are learning so much more about our bodies that we can really open up and look at all of those things. And I think for myself, I refer to a lot of naturopaths or functional medicine doctors because I feel like really looking at our nutritional status and trying to figure out are there things that I'm eating that we think are healthy for us, but turns out for my body might not be. Maybe it's an irritant. Or is there trauma that's stored in my system that I really need to work through, whether that's through body work or whether that's through counseling or both. But chiropractic can't be left out of that either, in my opinion, because we are dealing with the central nervous system and the peripheral nerves, and that plays a role. I also refer to acupuncture a lot in those things too, because I think when we look at the energy system of the body, the Chinese medicine talks about qi, and if that qi is blocked in certain ways, we're going to have body systems that are not functioning at their optimum. So we may not be fully into a disease process yet, but are we at homeostasis where we're really performing well? Are we somewhere in between? So I really like to dig in with my patients and talk about all of those things and explore them. And one of the things that I always promise my patients on the front end is I can't promise you that I'm going to be able to help you with your problem, but I can promise you that I can give you more ideas of what might be next if I'm not the right practitioner for you, or if I get a piece of it and then I think that you need to continue on that journey to try to figure it out. I'm going to help you try to figure out some things to go. I don't want to just leave you and say, okay, well, that's it. I don't have anything else to offer you. Sorry.
Which I could climb on a soapbox every single day for the rest of my life about because I feel like, I mean, there's so many specialists, which is so great in so many ways because you can go, a mile deep on an inch of surface in an area if you're specializing in something. But then if they're like, nope, I can't help you, and you get passed on to the next person, or like just you have to figure out how to get passed on to
Yeah.
the next person, it can be very frustrating. So,
Really frustrating. And I've had some patients that they're just, sometimes I'm kind of a last ditch effort and they're just so frustrated and you can see that not only are they dealing with their health problems, but then they're also dealing with the frustration and feeling like they're crazy half the time
mhm.
or feeling ignored in the process. And I always want to be a person, and I try to be a person that I'm at least a sounding board and a listening ear for them. And I want to validate what they're feeling. And then I want to see if I can help them. I do like to help fix things. That is why I got into the profession. But at the same time, sometimes all a patient needs is just to feel heard and to feel validated that they're not crazy, that this is going on in their body. And sometimes even if we are not successful in figuring it out, because a lot of times I'm like, I don't know. I don't know why this is going on for you. Um, and I don't, in the end, still have a solution for them or a way to fix it. But most of the time, people are really grateful that at least they feel like they were heard, they were validated, and they have a calming effect on their brain and nervous system, even from that, that they're like, okay, I have some people in my court that are listening to me and they're rooting for me to figure this out. And then they can kind of take a breath and be able to like keep journeying on with, I don't know, I'm rambling now, but yeah, you know what I mean? They feel like somebody is helping them to figure this out too.
Absolutely. And I think that's so important in a practitioner of any industry, like chiropractic or otherwise, like finding somebody who cares enough to like try to help figure out, even if they don't know the answer, or at least help you feel heard and like validated. That's like what most people really need at the end of the day.
Yeah, I agree.
Okay, one other thing that I had asked you about in one of our sessions is TMJ. So is that something that you see people with sometimes? And that's like, oh, I'm like blanking on what it stands for, but like in your jaw, basically the
Yes.
tension.
Yeah, temporal mandibular joint.
Mm,
So yes, problems with the TMJ, problems with the jaw. I do treat that relatively commonly, and chiropractic sometimes can do a beautiful job with it. Sometimes it's not the solution, but it's always, to me, it's always worth giving it a try. What people will present with if somebody doesn't has never experienced it, sometimes they will have clicking or popping in their jaw when they're trying to chew. Sometimes they will have pretty significant pain because there can be swelling in that joint and on one side or both. Sometimes they'll feel a shift if they feel a shift in their jaw. And occasionally it can cause headaches. And so, because all of those muscles really kind of tie into the upper cervical area, and that sometimes can trigger a lot of tension and a lot of headaches and things like that. So, yeah, chiropractic certainly can help with that sometimes. And then sometimes it's not the solution, but I've also, once again, acupuncture does a beautiful job with that. Sometimes I'll talk to people about clenching their teeth at night because sometimes stress and anxiety is creating the problem. And if they're grinding or they're clenching their teeth, then we talk about sleep habits. We might even talk about potentially a night guard or something. I don't offer those, but usually their dentist or somebody does. And finding ways to alleviate that stress. We talk about calming our brains down before we go to bed at night so that we can reduce that tension and that reason for the stress and anxiety so that we're not grinding and everything. And then the chiropractic adjustments hopefully will help with being able to realign the jaw and get the joints moving better and allow that inflammation to go down and the muscles to go back to, fire when ready and don't fire when it's not supposed to.
definitely. Well, I think the common thread of our conversation has certainly been like, yes, chiropractic care can help with this, but also this could help with it and this could help with it. And there are many facets that are all intertwined. And that's kind of the theme of this whole show. Let's be real, is like all of these things interact with each other. And so for people who are listening, if they're like, I'm already going to acupuncture or I'm already seeing a therapist, but I haven't been to a chiropractor and I'd like to try adding that into my routine, whether it's just general maintenance to feel their best or whether they're having, one of these problems and they need help figuring out like, I don't know what style I want. I don't know how to find somebody. Like, what advice would you give them?
I definitely think that it's always important for us to find a practitioner that we feel comfortable with, that we feel heard by, and that their treatment plan aligns with our goals. So sometimes we can have different business models within chiropractic, and that's fair and fine. And a lot of them are for longer treatment plans, and those are valid. But if a person doesn't necessarily know if they're going to enjoy the experience of chiropractic, if it's going to be helpful, for me, I don't do long treatment plans for people. I have people that have seen me for years and years and years because they decided that they really enjoy how they feel with chiropractic, and so they want to continue to come maybe on a monthly basis or whatever we deem as being the way to help them. But some chiropractic practices offer like year-long care plans and things like that. And if that's your goal and there are reasons for that that are valid, But sometimes it's nice to just try it out to see if that is going to work for you. So, finding an office that fits your goals, that fits your personality as far as the way the office flows and the makes you comfortable. And then, of course, the biggest thing is that you're able to get the results that you really want. That doesn't necessarily mean that the doctor is responsible for helping every reason and problem that you come in. That's not what that means. But I think at the end of the day, we should feel like the doctor did their best. And then if they're not helping you in the goals that you came for, then being honest with that and saying, okay, I don't think we're reaching these goals. Let's look at other ways that perhaps we can find someone else that could help you, or find other ways that we can help you within our office. I think that's an important thing to find in any chiropractic office.
I love that. If we have listeners who are in high school or in college or who are adults, but they're thinking about a career switch, what would you wish you would have known, like going into school and studying this?
I feel like it's such it's an amazing profession. It's an amazing field. The human body, anytime you're studying the human body is just, it's awe-inspiring and it's amazing. And you have the depth that you decide to go. You study it as deeply or you can go as surface level as you really want to. You get out of it what you put into it. One thing I think that if a person were jumping into this field, I think if they think that they're going to run their own practice, definitely get some business knowledge,
Mm,
and maybe work on having that as kind of like a minor, or at least take some classes or read some books or something like that. Because I think that's something that the unfortunately the chiropractic schools only have so much time, and there's a lot to learn from a human body standpoint. So teaching you the business side of things is pretty deficient in the schools, or at least it was when I went to school. I think it's probably the same way. But I just think it's a beautiful field. It's really a fascinating field. The science is totally catching up with us, and it's actually validating. For many, many years, we didn't have the science and the research to prove what it was that we were actually doing. So therefore, sometimes people would say that we were, quacks and that we really didn't do anything, or that it was dangerous, all of which is not true. Our malpractice is probably one of the cheapest and all the medical fields, and that's because we're a very safe profession. Um, but I think just if you're going to get into it, take it seriously and um, stay in your lane, know where your place is, know what you can do and know what you can't do, and be honest with people about that. And don't do it from just a money perspective, but do it from the honesty of really genuinely trying to help people. And I think if we had a lot of people, which I think we do have a lot of people in our profession that are that way, we can help so many people improve their lives and grow older in a much better way. Let's face it, we have an aging population. We're all getting older, and we don't have the healthiest society. And I would love to be one of the people that helps to change that.
I love it. Okay, I have some wellnessy rapid fire questions for you if you're ready.
Okay, let's see.
Okay, morning or evening workout?
Evening for me, because I'm not a morning person.
Running or walking?
I really enjoy both. I've gotten into running here in the last few years, and I really do enjoy it. I see why people get addicted to it. But walking, I find to be very, it's just soothing to the brain and to the rest of the body. So I do enjoy both, and I think there's a place for both.
Oh man, we should have talked about running. Lifting or body weight?
Both are great. I'm a weightlifter, but my background was gymnastics, so body weight. I know people can be amazingly strong with just body weight, but I'm a big advocate for lifting. There's a lot of evidence for it helping people with osteoporosis, and yeah, big advocate for weightlifting.
Indoor or outdoor workouts?
I love being outside. I do most of my workouts indoors just because of my the time of day that I'm able to do it. But man, get outside, get some sunshine, get some daylight, get some fresh air, and yeah, enjoy nature.
Especially with our longer days now.
Yes.
Juice or smoothie?
I'm a smoothie girl. Yeah. Yeah.
Coffee or matcha?
I love them both. Love matcha, but I'm a coffee girl. Yeah.
Salad or bowl?
Bowl.
Pizza or pasta?
Pizza.
Tacos or quesadilla?
Quesadilla.
An early riser or night owl?
As I've gotten older, I was always a night owl. As I've gotten older and had two children, I've become a little bit more of an earlier riser, but we are not talking early. We are, we're talking like, but yeah, I can't really sleep in anymore, unfortunately.
Okay, Dr. Peterson, thank you so much for coming on. For people who are local to Knoxville, where can they come see you? If they're not local, is there anywhere they can follow along in case they're ever in the area? How can everyone get connected with you?
Okay, so I am in the Knoxville area. We are in the Norwood area. I'm on Merchants Road. We've been here for a long time. My dad started this practice, and we've been here for a really long time. Um, this year, I'm going through some transitions because I took over primary management of the practice over from my brother. And so my website is drfranyapeterson.com. We are expanding the business a bit to incorporate a little bit more integrative and more multidiscipline. So the name is McLaughlin Chiropractic. That's my family name. But it's going to be McLaughlin Center for Wellness. So I'm in the phase of I just got the IRS information back. And so we are going to be doing some changes with the website and social media and all of those things. So unfortunately, this is hitting me at a time where things are kind of in a transition state, but you can still find my website. It needs a little work. And then social media wise, I do have a Facebook page, McLaughlin Chiropractic. But once again, we're in the process. So bear with me, people. Don't judge me on my social media and all of those things. It's got some work to do.
Oh, amazing. Well, that's so exciting. I'm looking forward to, following along the journey of the other things that you guys will be offering.
Thank you, Haven. I really am so grateful that you've had me on. I really appreciate it very much. And I love that you're doing this podcast just to help people to be on their health journey and have the resources to find out more information. Your podcast is awesome. I listen to it and it's fantastic. So thank you for doing this.
Well, you're so sweet. We have a similar mission, just different ways. So I'm so thankful for you as well. And thank you for coming on today.
Oh, thank you so much.
Thank you so much for tuning in to this episode of the Health by Haven podcast. If you enjoyed today's episode, please be sure to give the show a 5-star rating and leave a review. It makes such a huge difference in reaching new people and spreading the joy of healthy living. I would also be so appreciative if you subscribe to the show in the listening app of your choice so you never miss an episode. Your support truly means the world to me. Have a happy, healthy day, and I'll talk to you again soon.